Our next bone is clavicle. So the introduction to clavicle, it is also known as the collarbone or the beauty bone. Medial to clavicle, sternum will be present along with the first rib cartilage, whereas to the lateral side of the clavicle, acromion process will be present. Clavicle helps in the transmission of weight from the upper limb to the sternum. Features of clavicle, it is subcutaneous, the only long bone lying horizontal with two primary centers of ossification, no medullary cavity, membranocartilaginous type of ossification, may be pierced through the cutaneous nerve, intermediate supraclavicular nerve, which arises from the C3, C4 roots of cervical plexus. It supplies the skin of supraclavicular region. Damage to the intermediate supraclavicular nerve leads to numbness or tingling sensation in the supraclavicular region of the skin. Parts of the clavicle. It has two ends and a shaft. The two ends are medial and lateral end. Medial end is also known as the sternal end. Lateral end is also known as the acromial end. The medial end is quadrangular, whereas the lateral end is flattened. This is the medial end. The attachments of the medial end is the sternoclavicular joint and the fibrous capsule of the sternoclavicular joint, and also the interclavicular joint gets attached here in the medial end. This is the flattened lateral end. Here the attachments are acromioclavicular joint, the fibrous capsule of acromioclavicular joint is attached to this end. This is the anatomical position. This is the medial end, the lateral end, this is the shaft. Now this shaft is divided into two parts, that is the medial 2/3 and the lateral 1/3. The medial 2/3 is round and convex forwards, whereas the lateral end is flat and concave forwards. The lateral 1/3 part of the shaft has two surfaces and two borders. The two surfaces are the superior surface and the inferior surface. The two borders are the anterior border and the posterior border. The lateral 1/3 remains subcutaneous between the origin of deltoid and the insertion of trapezius. The inferior surface has a conoid tubercle, the trapezoid ridge. Borders of the lateral 1/3, anterior border and the posterior border. Anterior border is the origin for the deltoid muscle, whereas the posterior border remains the insertion for the trapezius muscle. This is the medial 2/3 end of the shaft, which is quadrangular, so has four surfaces: the superior, inferior, anterior and the posterior. So superior surface is known as the origin for the sternal. Superior surface of the medial 2/3 of the shaft is the origin for the clavicular head of sternocleidomastoid. The inferior surface has an impression for the costoclavicular ligament, where the costoclavicular ligament attaches, and here we get the subclavian groove where subclavius muscle gets attached, and at the lateral end of the subclavius we get the nutrient foramen. Anterior surface of the medial 2/3 of the shaft gives the origin of pectoralis major muscle, whereas the posterior surface gives the origin for sternohyoid muscle. Clinical of clavicle. Absence of clavicle leads to cleidocranial dysostosis. The fracture point of the clavicle is seen mostly in the junction of the medial 2/3 and the lateral 1/3.